Good morning. Hey, I'm V, and today I'll be doing my abdominal assessment. And I'll begin by apologizing. I just began my work week last night and I accidentally left my stethoscope at work because I knew I was going to be back there tonight, but then totally forgot about this. So I will be explaining in great detail about what I'm doing and with what as far as the stethoscope goes. But this is my patient, and first I would wash my hands, of course. I would introduce myself to the patient, and I would definitely explain to him calmly and thoroughly what I'm going to do before I do it, and then as I'm doing it. And if he has any questions or anything, he'll be able to ask me if he'd like. This would normally be a hospital setting, doctor's office setting, and so he would be dressed appropriately, gown on or whatever, draped appropriately for privacy and, comfort measures as well, warmth and stuff like that. So with all that being said and done, then I'll talk to the patient and ask him first if he's been having any problems. You have any problems, any hurt areas, tender spots, or anything like that?
No, ma'am.
No, okay. Any problems urinating? How about your bowels? Like, are you having normal, regular bowel movements?
That's normal.
Okay, good. And so all that's good. So then I would begin my assessment. I would first begin, as I was talking to him, I was doing a general appearance overall, and did note that, there was no abdominal distension. Didn't seem like he was in any pain. It overall looks pretty good. So now I just need to confirm that through my assessment. And I would first listen to each quadrant of his abdomen with my stethoscope and make sure I would hear either active, hyperactive, hypoactive bowel sounds in each 4 quadrant. And as I'm doing that, I'm also able to feel for any kind of hardness or anything. And it seems normal. And I do hear active bowel sounds. I want to be sure to tell you that if he doesn't, and anything is absent, to confirm that, I would listen to each quadrant for an entire 5 minutes to make sure that it is absent indeed, because hypoactive could be a couple of minutes apart. And so I would do that for each quadrant as well. And he has good bowel sounds. Like I said, I would lift up his shirt and I would check the umbilicus, and that looks, normal, intact. Then I would also auscultate his vascular areas in his abdominal region, such as, right above his umbilicus for the abdominal aorta, and I would listen for that and note any abnormalities or bruits, and if so, I would notify the doctor immediately, because it could be indicative of a AAA, abdominal aortic aneurysm. And also listening for the iliac, and as well as his fall asleep, as well as femoral. And so all that is good. And then I would begin to percuss all 4 quadrants of his abdomen, and it's a lightly percussion. And I would note also any kind of abnormal sounds. You want to hear a thump, but if you're on that specific area, such as his gallbladder in the upper right quadrant, like, I will want to make sure that's what it was and stay there for a moment to confirm it. And I could also, as I'm percussing, while I'm in the lower right quad, I can kind of do like a deep palpitation. And he has not had an appendectomy. And so, do you feel any pain as I'm doing that?
No.
Okay, good. And so I can also ask him to lift this leg up, and it's not hurting him. And so that's good, which could be another indicator of appendicitis. I could also do a deep palpitation to the upper right quadrant. And as I'm doing that deep palpitation, I can ask him to take a deep breath. Do you feel any tenderness or anything? Okay, great. Which is good because it seems like he has a normal gallbladder. And doesn't have any flank pain or anything. If he did have like a NG tube or something, we would definitely, he'd be at least 30 degrees, but suctioning intermittently or whatever, or I would turn it off to here for accurate bowel sounds. I would also percuss the abdomen for fluid wave, and you want to be able to hear that because we do have fluid constantly running through our entire abdomen. And of course I would know any kind of characteristics of any masses or any abnormalities present. Also, I would palpate his bladder area, and do you have any tenderness or anything? And he says no, which is good, but yet if there were an abnormality or any kind of tenderness upon palpitation, like I would note the characteristics of it or the mass or, any details to further help the doctor come to a proper diagnosis for this patient. And everything seems to be good with him, which is great. I don't know if I had mentioned it, but when I was listening for his vascular areas, I did turn my stethoscope to the bell part of it for accurate auscultation. He did not have any kind of rebound tenderness, like whenever I would release quickly, which is good. Overall, he is a healthy 27-year-old. Also, I would notice, like, visually with his, gown up, because normally, you would have to look so I can note the skin color. I would also note the warmthness, the, feeling of it. If he was distended, emaciated, or anything like that, and he's not. Notice any bruising or anything like that, just anything that's pertinent to the patient. And that's it. So I hope y'all enjoyed. Thank you.